Okay, well, I think we're going to get started. I'm going to try to continue to admit people unless somebody else also has that capacity. And then, John, are you able to do that?
Rick, I can do that.
That would be great. Thank you so much. So welcome, everybody. Very excited to be sharing this training with you all. My name is Rick Brooks. I am the Director of Healthcare Workforce Transformation at the Office of Health and Human Services. And I am joined today by John Dare, who is a data analyst and has been very instrumental in helping to create and update and improve the healthcare workforce dashboard, which we're going to be looking at in detail today. So John may jump in to keep me honest and to clarify certain things that I maybe could misrepresent. There's a lot to cover. Do feel free to put questions in the chat. I'm not necessarily going to be able to see everybody's hands, but we're happy to take questions as practical. There's also an opportunity always to follow up afterwards. You can contact me directly through email. I'm also going to share with you at some point a formal data request form that folks can use to ask for additional information or even additional capacity that doesn't currently exist within the dashboard. So very quickly, the dashboard was created maybe 2.5 years ago now with the purpose of trying to better understand the nature of our healthcare workforce through data. And to do so, we started with the best source of data for our healthcare workforce, and that's the Rhode Island Department of Health's licensure data. And we were able to bring that data into what's called the EOHHS data ecosystem, which has over 20 different data sources, and it enabled us to match licensure data with other data sources, most importantly, the Department of Labor and Training's wage record data, but also other data, which, as you'll see as we walk through the dashboard, helps us answer many questions that we don't know just from the licensure data alone. So all health professionals have to apply for and renew licenses every 2 years, and certain data is collected there. And in the future, we will be collecting additional data there. But through data matching, we're able to learn more about our licensed workforce. The data that comes from the licensure division into the ecosystem is individual level records, and that's why we're able to match it. It's real-time data, but it's completely de-identified. It's aggregate data. It's completely confidential. There's no way to identify either individuals or, for that matter, employers. When we search on the dashboard, as we will today, if the results are smaller than 10 individuals, that data is suppressed to further protect confidentiality. So with that, let me get right into the dashboard. You are, I hope, seeing the table of contents. Is that true? Somebody give me an amen.
Yes.
Okay, great. So this table of contents captures all the different pages within the dashboard. And we'll walk through many, but not all of these today. We won't have time to do all of them, but I encourage you to explore on your own. And I will point out as we do this walkthrough some very consistent features and tools that you'll see on every dashboard and help you navigate as you go. Just to look at a couple of non-data pages, user tips just has some basic information about how to navigate through the pages, to use the filters and so forth. And I will, again, share that as we go. The other thing I want to point to briefly is the glossary. There's some additional information here. There's some notes that explain certain pieces. For example, folks are generally very interested in wages, and I'll probably say this more than once. Wage information comes from the Department of Labor and Training, but it is not hourly wages. It is individual earnings by quarter, calendar quarter, for every individual who's employed in Rhode Island. But it does not distinguish between part-time and full-time employment, certainly doesn't distinguish between new employees and long-term employees. And as I said, most importantly, it does not identify or contain any information on hourly wages. It also doesn't differentiate whether somebody has worked only for part of the year. But all of that, with all those provisos aside, it's still a very interesting and useful tool, especially for looking at trends. And the other thing I want to just point out briefly in this glossary is what's called NAICS codes, North American Industry Classification System. This is a way of categorizing different employer types, and so it enables us to drill down significantly. So let's go to the this page called, actually, why don't we go to, I'm going to go to a different page. We're going to go to a page called gender. But we're going to look at this for now, just to show you some of the different features. Okay, so at the top, we see healthcare setting and non-healthcare setting. Healthcare settings, these are all defined by the Bureau of Labor Statistics. When we click on healthcare setting, it becomes black, and that enables us to see the 4 different healthcare settings that are categorized by the Bureau of Labor Statistics. And we can select any of them to see information just about that setting. If we click on non-healthcare setting, we see additional settings in this drop-down list. For example, education or government. So these are areas where licensed healthcare workers are also employed in sometimes significant numbers, but they are not considered healthcare settings by the Bureau of Labor Statistics. We still capture them, however. And then I mentioned a moment ago NAICS codes. I'll just show you, for example, if we click on ambulatory healthcare services, we will then see the NAICS codes that come up under that. And that's a way to further drill down. So if we wanted to know about home healthcare services, we would select ambulatory and then home healthcare services. And we could look at just the licensed occupations that we were interested in within the home care services. In addition, we have drop-down menus related to race and ethnicity. I won't click on all of them in the interest of time, but age groups, I will show you these, just the different age categories, gender, and also calendar year. So we can look at the graphs display the last 10 years, but we can also select just 1 year. And then the ones that I didn't mention, probably most importantly, is the licensure group. So we can select from 38 different license types from the Department of Health. And then now within physicians, so there's 2 types of physicians, we can also look at the top 30 specialties, top meaning by the most number of licensed physicians that are in these specialties, which gives us a great deal more information as well. And last but not least, the school name. All of these filters and menus show up on just about every page in the dashboard. There are some exceptions. And the schools, because we have selected physicians, it's just showing us the most significant schools from which our physician workforce has graduated. Because there are so many, the only one that shows up individually here is Brown University School of Medicine. But if we had, just real quickly, if I added registered nurses, you would then see all of those schools that graduate registered nurses as well. So that's just a quick overview of the different tools on the dashboard. I want to give you a little heads up. There is going to be a test. There are a couple of little hands-on exercises I'm going to encourage you to do as part of this training so that you can navigate yourself and see how that goes and get the feel of it. So let's take a look now at page that I was going to look at before. Oh, I should point out here, this tool for navigation. When we click on show navigation, it shows us our table of contents. We can hide it in order to see these other menus. Oh, and one other thing, clear filters, very important, because as we select different items as we just did, we don't always see which ones are selected. And if we left and came back to this page, they would still be selected. So the first thing that I think is important to do is just clear your filters when you go to a new page. So we are now going to go to a new page, which is called Number of Licensed Healthcare Workers in Rhode Island. And as I said, I will clear filters first. And for this little exercise, we're going to select from the license types, we're going to select registered nurse. Okay. So we've selected registered nurse. And what we now see as a result is a graph that shows us the number of licensed registered nurses. That's the total, that's the yellow bar showing us the total number of licensed registered nurses. The blue bar, which is showing us the number of those licensed registered nurses who are employed in Rhode Island. And the green bar shows us the number who are employed in one of those 4 healthcare settings that I mentioned previously. The red and light blue lines that run through this are just showing us the percentage that those green and blue bars represent of the total licensed, in this case, registered nurse, number of licensed registered nurses in the state. I think those are the most important things I wanted to show you. I'll just note, because of the kind of thing we can learn from these dashboards, that in 2017, the state of Rhode Island left the Interstate Nursing Compact, which now allows individuals licensed in other states, or at least those states that participate, to be granted a reciprocal license in Rhode Island, or to be able to work in Rhode Island without applying for a separate license. When we left the Nursing Compact, those nurses from other states needed to apply for a separate Rhode Island license. And so the number of license holders went up quite a bit until 2024, when we rejoined the Interstate Nursing Compact, and we are seeing that number of license holders decrease. You can see the total number of nurses, registered nurses employed either in Rhode Island overall or in healthcare settings did not change dramatically, because it didn't create or reduce jobs. It just increased the number of license holders. And I do want to speak briefly to the big gap here, which often catches people's eye. So why are there so many more licensees than employed licensees? And there's any number of reasons. One I just mentioned, which is that some people hold licenses who don't hold Rhode Island license that don't actually work in Rhode Island. But other explanations include people who may be licensed in Rhode Island but working out of state. So this is just people working in Rhode Island we're looking at. It could be people who are self-employed. Perhaps in some occupations, people may be doing things like telehealth, or they may be in private practice. They also may be out of the workforce, either temporarily, or they could be retired, but some people keep their licenses active even if they're retired. So those are some of the explanations for why the total number of licensees exceeds in pretty much every occupation the number employed. Okay, the next page we are going to go to is the one about median annual wages, or annualized wages, because 1 quarter's earnings are multiplied by 4. So in this case, first we'll clear our filters, and then I'm going to select healthcare settings and nursing assistant. All right, so we are looking now. By the way, almost all of these pages now, except the one we just looked at, are only looking at those individuals actually working in Rhode Island. They're not looking at total license holders. They're just looking at people working in Rhode Island. The reason I chose healthcare setting here is because there could be, and probably are, nursing assistants who are working in non-healthcare settings and not working as a nursing assistant. So maybe they worked for a while as a nursing assistant and now they're working in the fast food industry. They would show up under non-healthcare settings. So we're looking at nursing assistants here in healthcare settings. And when we do, what we see a couple of things on this page. This bar chart on the right shows us the total number employed, and if we went back to that previous page, we would see this number for nursing assistants employed in healthcare settings. And here we see the median earnings in each year, median annual earnings. Again, keeping in mind, this does not differentiate between part-time or full-time. It is not based on hourly wages. It's just, for that matter, it doesn't differentiate for overtime. And it doesn't differentiate for folks who may have been out of the workforce for three out of 4 quarters. So typically all of that means that the median annual earnings tend to look lower than they would be if you took the average hourly wage and multiplied it by 2,000 hours a year, which is full-time. Now, just to show you another opportunity of what we can do here. And by the way, well, before I do that, I just want to show. So if we wanted to know just what this looked like for folks who got their nursing assistant training at a certain training provider, we could select that. And then I'm going to pick one, Bristol Community College. Okay, so that's very small, bad choice, but that does show how we suppress the data. Community College of Rhode Island, and then you can see we're just looking at those folks, CNAs, who got their training at CCRI. But I also want to show you that we can compare earnings as well. So I'm going to select practical nurses as well. And now you can see on the lower right, the number of LPNs and the number of CNAs, and on the wage chart, we can see how those compare, right? Just as we can look at, subset by school, we could also look at a subset by race or age or gender. It won't be comparing those comparisons we can do on the separate pages that are called race and ethnicity, age and gender, or for that matter, school. So you're not seeing a comparison between schools, and you can't do that here. So if we chose 2 different schools, we would just be seeing the total of graduates from those 2 schools. Okay. Okay, we're going to clear this filter, and now it's your turn. And I am going to drop in the chat, if I can here, our first exercise. And that exercise is okay. What was the total number of licensed nursing assistants employed in a Rhode Island healthcare setting in 2017, 2021, and 2025. So that's actually before, during, and after the pandemic. Okay. So you can I'll just tell you, it's one of those 2 pages that we just looked at is where you will find the answer. So why don't you raise your hand when you think you have the answer? I'm not going to pick on you, don't worry, but just to get a sense. Okay, I'll give you 1 more minute and then all will be revealed. Okay. Okay, so I'm going to put the answer in the chat and then I will demonstrate to you how I got that, and hopefully some of you got this, and hopefully I did it right myself. So we are going back to this number of licensed healthcare workers in Rhode Island. We're going to clear our filters, and then the license type that we're looking into here is nursing assistant, right? So we select nursing assistant, and then we're simply going to look at those 3 years in question, 2017, and we're looking at the number employed in a healthcare setting, which is the green. And when we hover over this, another feature of the dashboard, when you hover over these data visualizations, you get these little pop-ups. So when you hover over the green bar, it shows you the number employed in healthcare in 2017 was 13,003. And if we go to 2021, do the same thing over the green bar, there's the 12,396. And whoops. And last but not least, if we go to 2025 and hover again over the green bar, we see the 13,888 nursing assistants employed in a healthcare setting in Rhode Island. All right. Good, I hope that was clear to you. We are now going to move on to race and ethnicity. We'll clear our filters for start. And then, well, I think I will again choose nursing assistant. But just to be clear, we could choose anything at all here. I'll just say a couple of things about race and ethnicity data. It's incomplete. It's provided by the individuals, however, and it's also not required. So some individual, it's self-reported, but it's in many cases incomplete. Some folks select other. In some cases, there's unknown. But overall, it's still quite useful and by far the best that we have. So we have selected nursing assistant. And the first thing I want to show you is that we don't actually have to select, because this is the race and ethnicity page, it's sort of preset to show us a breakdown. So I don't need to go to this menu here unless I only want to look at one of those. But I can look at all of them here. So and then, so I just want to explain these four tables that are presets. The first one is showing us the number and average amongst everything that we've selected. So we haven't made any distinctions. We've just got nursing assistants. So we are seeing those same numbers that we've seen previously for the total employment in the state. If we picked healthcare setting, we'd see the number we just looked at before. And again, we can narrow it down to school. We can narrow it by the setting within, one of these major settings or one of the smaller NAICS codes. We could look at it by age as well. But right now, we're just looking at nursing assistants, all nursing assistants employed anywhere in Rhode Island. And this shows us the percentage breakdown. As we can see, the percentage of white nursing assistants has declined over the last 10 years. The percentage of Hispanic has grown dramatically, sort of more or less making up that difference. Other race and ethnicities have remained fairly constant. The other table of interest here is that it shows us median annualized earnings by those race and ethnicity categories. If we wanted to look at, for example, if we wanted to narrow it down and say, well, we're going to sort of do people of color more generally, but not including other, which we don't know what that is, or declined or unknown. So we would have this kind of, it would look something like this. So this is not comparing, because we've removed white from this. Yeah. Oh, actually, why is white still showing up? Oh, because somehow I didn't do it properly. Okay. So now we're seeing just Hispanic, Black, and Asian is all that's large enough numbers to show up. So you can see how you can narrow it down using these filters. I'm going to clear these filters, and one other thing, I'm going to undo this. By the way, you can clear the selection on your menu with this little eraser here. So rather than clearing the filter for the whole page, if you just want to clear one drop-down menu, you can do that. And if we wanted to, now we're back to our race and ethnicity distribution of nursing assistants across all employment in Rhode Island. If we wanted to look at it just in hospitals, for example, we would do that, and then we could see, how does it compare, right? What does the diversity look like in hospitals? We could compare that to nursing homes. We could compare it to outpatient. We could compare it if we do add non-healthcare settings. We could compare it, for example, to government. So you get the idea. That's how the race and ethnicity page works.
Rick, we have a hand raised. Shani, do you have a question?
Maybe that's from
before. Yeah.
I guess.
I'm sorry, that was from before.
Okay. No problem.
Okay, no worries. So I'm just going to note, without going to all these other pages, that you can see that under race and ethnicity is age and gender. Those pages function essentially the same way. They look the same. So just so you know, we're going to go to setting. And I promise we won't pick nursing assistant. Let's pick physician assistant. Did I clear my filters? Maybe I should make sure I did. I'm going to do that again. Physician assistant. So now we are looking at the distribution of physician assistants in those, well, right now we're looking at all the settings because we haven't chosen healthcare or non-healthcare. If we don't choose either one, it just brings up all of the settings. If we chose healthcare settings only, again, you'd just see those 4 categories. We add non-healthcare, we see the larger set of categories. And if we wanted to drill down NAICS codes, you'll see all these different NAICS codes. So to make it practical, we would just do, for instance, like I showed you before. Well, I think a better example would be to choose, we'll choose nursing and residential so you can see, okay, so there's not a lot of physician assistants in that setting. So we'll choose ambulatory. And then you do have some different NAICS codes that you could look more closely at employment of physician assistants in these settings. Clear this though, and if we wanted, so we are seeing now all the health. We are seeing the health. I'm going to use all these healthcare settings because physician assistants don't show up in that many. But here you can see physician assistants, 29.3% of them who work in Rhode Island are working in hospitals. And you can see the number there too, 222 PAs. Most of them work in outpatient ambulatory healthcare settings. And if you were curious, while we can't compare these here, you could take your pen and pencil and write down what those numbers and percentages look like for PAs. And let's say you wanted to look at, I wonder how that compares to advanced practice nurses. So you would clear the selection and then choose advanced practice nurses. And then you could see, how that compares. And you'd see that PAs, I believe, are a bit more concentrated in ambulatory and hospitals, but not other settings than advanced practice nurses, who are found in more settings than PAs are generally. So we are looking right now at advanced practice nurses by setting, and the wage chart on the lower left is now showing us advanced practice nurse median annual earnings by setting. Okay, and when you hover over this, again, you get a pop-up. No, it doesn't want to pop up, but there we go. So just to sort of take a look at the distribution, you can actually slide back to each year, earlier year, 2021, 2020, etc. So that's the setting tab. And now, the moment you've been waiting for, our second exercise. And this question is, what percent of LPNs employed in Rhode Island healthcare settings identify as Black? And which healthcare setting has the highest percentage of Black LPNs in 2025? Okay, a little bit more challenging. Give it a whirl. I'm going to give you a hint on this. The hint is use the race and ethnicity page. Okay. And same thing, when you think you have the answer, when you do have the answer, please raise your hand. All right, I'm gonna walk you through this. Here's the answer. So looking at this this page, we clear our filters. We're looking for the percent of LPNs in healthcare settings. So we're going to click healthcare settings, and we're going to select practical nurses. And this is the racial distribution, race and ethnicity distribution. So, and when we hover over this, we can see that the percentage of Black LPNs in 2025 in all healthcare settings, employed in healthcare settings, is 23.5%. Okay, now the trickier piece, we could have also gone back to the settings page, but if we select, the other question was, what's the percentage, which healthcare setting had the highest percentage of Black LPNs? So in this case, we're going to look at the 4 settings just quickly and do it this way. So we'll look at ambulatory, the percentages. 16%. Okay. In hospitals, it's 17%. In nursing and residential care, it's 28.5%. And in social assistance, it's 23%. So the answer was nursing and residential care facilities, and that's at 28.5%. Okay. Happy to take a question if people are, if your heads are spinning. But if not, we'll keep going. So the next one we're going to look at is schools. This is telling us where folks got their relevant training and education. So we clear our filter and let's look at registered nurses. And we will pick for our school, we'll pick URI. All right, so what we're seeing here is a subset of all registered nurses, specifically those who got their nursing degree from URI. Similar to other pages, this visualization in the upper right-hand side of the page is showing us by year the number of URI grads who are, or number of registered nurses who got their degree at URI. You can see that's 1,698 in the most recent year, 2025. It also happens to show us what the average age is of that group. So even though we're not on the age page, and even though we haven't selected a specific age group, it is showing us the average. These are like preset graphs. It shows 100% because we're only looking at URI. So it's 100% of the URI numbers are shown here. This is the median annualized earnings for URI graduates over the past 10 years. And this is actually the same thing because we've only selected URI. However, if we went in and we added Rhode Island College, because this is the school page, we can look at 2 schools at once, or for that matter, 3 schools at once. Roger Williams doesn't have that. But if we put in community college, we'd see all 3 schools. We'd see the total number. Now we're up to 8,300. We see the median age is a little higher, 47 point, or I forget whether it was higher or lower, 47.1. Now when we look at this annualized median wage, it's showing us the average of those 3 that we selected, the 3 schools we selected. And here are the 3 schools separately. So they actually have pretty much come to the same place. Again, keeping in mind, this doesn't take into consideration part-time or full-time employment. All right. Keep going here. The next one I want to show you are the specialty tabs. So we have a page that just shows advanced practice RN specialties. And it allows us to compare those specialties because this is the specialty page and that's how you know what it is you'll be able to compare. So we don't need to select the register, the occupation because it's already preset, but we can select the advanced, the specific specialty for these APRNs. So I'm going to show you, for example, here's a clinical nurse, a nurse practitioner, and I'm going to add to that so that you can see how the comparisons work, a nurse anesthetist. Nurse anesthetists tend to be the highest paid of the advanced practice nurses, but they are small in number. So you can see here the APR, the CRNAs, nurse anesthetists. Here's the family practice nurse practitioners. These are their relative median annualized earnings. This is the median between the two. And that's essentially what that looks like. Again, if, as before, if you wanted to just look at APR and say graduated from a certain school or work in a certain setting or are of a certain race or age or gender, all of that can be done. Let's take a look at physician specialties. This is the newest feature on the dashboard, and you may have noticed that physician specialty, this drop-down list of the top 30, shows up on all the pages that we've looked at. That's not, unfortunately, the case currently for the advanced practice nurse specialties. Those are just on the APRN specialty page. So again, very similar though. The only two licensure groups that show up are physicians, but because we have two different types of physician licenses, they show up separately. I usually am interested in the combination of the two. And then once we have selected those, we can select from this list of the top 30 specialties. So many people are interested in information about the primary care workforce. As many of you know, there is no such specialty called primary care, but there are specialists that are more likely to be providing primary care, and those include following: family practice, gerontology, internal medicine, and pediatrics. Those are the ones that are most commonly counted, but not always. Sometimes OBGYN is included, and of course, sometimes specialists provide primary care, and sometimes primary care providers don't provide primary care. But this is, I show this because it's sort of proxy for primary care physician workforce. You can see the distribution just amongst these four specialties, internal medicine being the largest of the four primary care specialties. You can see here we show not as a line graph, but as a table, the median annualized earnings over the past 10 years. This is again the median of the four specialties that we've selected. Again, we see the total of the four and the median age of the four. Again, we could narrow it by setting. We could narrow it by NAICS code. Is that true? Maybe we can't narrow it by NAICS code on this one. And we can narrow it by race, ethnicity, age, and gender, so demographics. So I do have one more quiz for you. We can stay on this page. You can I'm just going to tell you it's on this page. The answers can be found. Okay, so here's the question. What was the largest physician specialty employed in Rhode Island in 2025? And what were the median annual earnings for this specialty? I know I should have offered prizes, generous prizes. But since I didn't, I will just share with you the answer and how we got there. The screen that you're looking at, as I said, is the screen to use for this, and the visualization in particular is this one in the lower right. So we didn't select any specialty here. It's showing all of them. And just by looking at it or hovering, we can see this light blue appears to be significantly bigger in size than any of the others. You can hover over all of them, but we do see that internal medicine is the largest of the specialties. And then actually, this is another feature. By clicking on it, it brings up just we could have scrolled through and found it as well. Here's the median earnings for 2025. And by clicking on it, it also brings up just that line of the table. Okay, we're running almost out of time. We've got 5 minutes. I'm going to show you one other thing real quickly, because it looks very different from everything else. And this is this shows us what additional licenses, if any, nursing assistants have progressed to or have obtained since 2010. So here we're seeing every single individual, 46,000, almost 47,000 individuals have had a CNA license one time or another since 2010. And we can break out those, the top 14.5% here, that went to some other license. And then we can look specifically the number and percentage that went on to become LPNs, RNs, or behavioral health licenses. In some cases, they went on to advanced practice registered nurses. And we can look at those by race and ethnicity. And while we don't have time to do that right now, I will. Well, I think I will just point out. So, for example, we see 14.5% of all CNAs that went on to another license. If we look at that by, we look at that by race, we're just looking at white CNAs, it jumps to 22%. We look at it Black, 12%, Hispanic, 8.6%. So we can see there are significant disparities in terms of nursing assistants who go beyond the CNA license to another clinical and typically better paid license. So that's an important fact for policymakers, for educators, for employers, for anybody in the state that's paying attention to these things. So that's just a quick view of that one. I will show you one other real quickly, and we call this inflow and outflow. This is a relatively new dashboard too. Instead of showing us just how many license holders there were each year, so there could be 50,000 one year and 50,000 the next, it doesn't tell us anything about the churn, how many left and how many were added. This helps us take a look at that. So in addition to the total number of licensees, and we haven't selected any license group, but let me just pick one. We'll pick clinical social. I have to deselect and then clinical social worker. So we're looking at the total number of clinical social workers licensed in Rhode Island. We could look at it by licensed and employed also. And this is showing us the percentage increase in 0% in 2025 because there haven't been license renewals yet. So that's a quick overview of all these different pages. I strongly encourage you to poke around on your own and see what you can find, see what you can learn. If what you learn seems surprising or doesn't make sense to you, or maybe you're concerned that you haven't done it right, feel free to reach out. Happy to walk through it with you or try it myself and see what we come up with. Also, just FYI, and for others who aren't on, that you may want to share this with, we have recorded this training session. We will post it on our website. And one last thing, we do have, I think I mentioned, a data request form. Oh, that's, yeah, okay, yeah. That can be used to request data, especially if it's more of an ambitious research project. It can be requested of the ecosystem team, and they will be taken in the order in which they are received, I think. So with that, we are, I guess, right on time, but I hope you found this worthwhile, and please do be in touch. Really would love to have your feedback. We are constantly tweaking and improving on this dashboard. It's come a long way, and I know there's a long way that it can still go. So thank you all very much. And again, really would welcome feedback now or anytime. All right.
Thanks so much, Rick. That was really helpful.
Great.
Thank you.
Thank you.
Thank you.